child who has been diagnosed ADD and conduct disorder, who's about to be thrown out of nursery school. By the way, the child has been in child care and nursery school since 3 months old. So unfortunately, in this case, you have a situation where the mother went back to work after a few months, maybe a month and a half, and the child has been in child care from very early in life. The mother was not available to fill in any way, but clearly there was a bonding problem because the mother literally worked from 7 to 7. The father, in many ways, tried to fill in as a caretaker, but he worked 9 to 5. But he's the one who brought the child to child care and picked up the child in child care. So in any case, they come, and this child is a biter, a screamer. He tells the mother he hates her guts. He kicks her, he punches her, he bites her. Primarily, his aggression is towards the mother. However, he also has tantrums with the father and is aggressive towards the father. They have already been to see 3 or 4 therapists who have all sorts of behavioral treatments, none of which seem to work for the mother. And the mother tells me in the first session that she left all those therapists because they all wanted to blame her. Now, that's an easy temptation since the mother actively provokes the child, actively rejects the child when the child acts up. And understandably, if your child's constantly having tantrums, embarrassing you in the supermarket, kicking you, biting you, telling you that that he hates you, you're going to begin to hate the child too. It's not the kind of relationship that you looked for when you had a child. So, but the mother. So I will not see a child unless I see the family in tandem. I frequently want to see the child in the context of the family because I don't think that a child has a broken brain or is defective. I believe that if a child has problems, first of all, the primary caregiver is the best person to treat that child or deal with those problems. My job, as I've described before at other conferences, is to basically be a coach, a Dutch uncle, or a grandfather, and to help the parents to mobilize their resources or gain new resources to be the people who solve the problem for their child. It doesn't help if I see a child alone and the child is acting very nicely with me because I'm nurturing and I'm nice and I listen to the child and talk to the child. What helps is for the parents to learn how to negotiate that child's needs and how to deal and set the limits on the child's acting out. So after speaking with the parents and getting some history, I become to understand that really the child is enraged and feels like a rejected child because he's always left every day. Either he's left at a child care center or he's brought to school, or if he's staying home with the babysitter, a full-time babysitter, mom leaves in the morning and dad leaves. And he always, and one of the big complaints the mother has is that when she comes home from work, the child avoids her or fights with her or kicks her, and she can't understand why. So I worked with, let me just briefly describe the mother and father, because the point of this description of this case is to show that when fathers are more active in the child rearing, you have one outcome in the case. And when the father is less active or more passive, there's another outcome. Now, there's the variable of me. I may be incompetent in one case or another, but I think a good part of it is related to the role of the father. In this case, I would describe the mother as a very hardworking, bright, but emotionally fragile, neglected woman. And she's also a very angry lady. The anger is just below the surface. And when I say fragile, what I mean by that is she'll break down crying terribly. She's wounded very easily. When the child rejects her, she can break down crying and fight with the child. Actually, with a 3-year-old child, she's arguing with the child and doesn't appreciate that the child, doesn't understand her, doesn't have reason to at this time, and doesn't care about her needs. She'll say, I just came home from work. Why are you bothering and yelling at me now? And the child couldn't care less. So, and the father, on the other hand, is a very passive, gentle father. He's very quiet. He's very reticent. He doesn't offer much leadership. He takes his cues from the wife, but he can be nurturing to the child. He's more accepting.
Just a quick question. What are the ages of the parents? How old were they?
The parents are approximately